Hello, welcome to your pre-operative video for your tummy tuck. If you're watching this, it means that you're either considering or already have scheduled or thinking about getting a tummy tuck. I wanted to create this video so that I can answer some of the essential questions and make the process a little bit easier for you, because having your surgery in Miami and being out of state sometimes is a very difficult process, and hopefully this will put your mind at ease and give you the necessary tools to prepare without unnecessary anxiety. Are you a candidate for a tummy tuck? The answer is always pretty simple. If you have a lot of muscle separation where your stomach feels very bulgy but not hard, if you have a lot of extra skin hanging, if you've had several kids, if you've had a lot of weight loss, most likely you are a candidate for a tummy tuck. One of the things I always ask my patients to determine if they have significant amount of intra-abdominal fat, which is fat that stays under the muscle. And the way you can figure that out is by standing in front of the mirror sideways and trying to suck in your stomach. When you suck in your stomach, if it becomes completely flat, it means that you do not have a lot of intra-abdominal fat. However, if you don't see a big difference when you try to suck it in and the stomach still bulges out and looks very drummy, it means that significant amount of excess fat is under the muscle, which means that even if you have a tummy tuck, your stomach will not be completely flat. It may be somewhat flatter, but will not be completely flat. It's important to remember, because not infrequently I have patients who get back to me feeling like they're not flat enough. And I do want to make sure that you understand that I can tighten the muscles as much as I can tighten the muscles, but if there is a lot of intra-abdominal pressure from all the fat pushing outward, no matter how tight I make it, it's still never going to be flat unless you lose the weight. And unfortunately, this particular fat is very difficult to lose because the only way to get to it is with diet and exercise. Now, once you determine that you're a good candidate for a tummy tuck, and you can certainly speak to your coordinators if there are still any questions, the coordinators have my cell phone number. They can forward me your pictures to confirm that you are in fact a good candidate. Once you've made that determination, in order to prepare for your surgery, there are only a few things that have to be done. If you're under 40 years of age, all you need is lab work. And the lab work that's required will be given to you by your coordinator. This is assuming that you have no medical problems, you're completely healthy, you don't take any medication, and you're under 40. If you are 40 or above, I require that you get medical clearance from your primary care doctor, as well as the lab work that will be given to you by your coordinator. You will also need to get an EKG and a letter stating that you are in good health and your doctor has no problems with you having the surgery. If you're 50 and above, on top of your medical clearance, I also require a cardiology clearance. If you have no cardiac issues whatsoever, your cardiologist just has to check you and say that there's no further workup needed and give you a letter stating that you may proceed. If you happen to be a person 50 or above and you take blood pressure medication or have had issues related to your heart in the past, I do want you to have an echo and a stress test that's within a year, confirming that there's no problem for you to undergo general anesthesia. I ask everyone to remember that cosmetic surgery is performed in an outpatient office-based surgery center, which means that it's not a hospital. And if God forbid anything happens to you, there's much less that can be done unless you're in the hospital setting. So it really goes only towards your safety. We want to make sure that everything is done with your safety in mind. It's not done to make your life difficult, of course. It's not done to make things more complicated. We're only asked for all of this in order to make sure that you're completely safe during your surgery. Now, in terms of your medications, if you happen to be taking medicine, Remember that other than an ACE inhibitor for blood pressure, you can continue taking all of your other medications. The only thing I ask that you stop is Advil, Aleve, aspirin, ibuprofen, or any other non-steroidal anti-inflammatory medication. And your doctor can certainly advise you on what is okay and what is not. Tylenol is okay, but anything that gets related to NSAIDs, NSAID, is not okay. Minimum 10 days prior to surgery. And then after surgery, I will instruct you when we speak in person, but after surgery, I'm actually okay with my patients taking Advil for pain control because it works quite well. So remember, no NSAIDs prior to surgery, at least 10 days before. Now, smoking is a major, major issue. Please make no mistake. The reason why we talk about stopping to smoke is because it's a real risk, especially if you have other medical problems. Potential for having wound breakdowns, tissue loss like necrosis, where a chunk of tissue can die off, is very real. And even though I tell my patients all the time when I meet them, and I talk about it in my other videos, I do want to reiterate the importance of not smoking. Minimum for 3 to 4 weeks prior to your surgery, you need to stop smoking because that will help decrease the risk for potential complications, which exist anyway. But if you smoke, certainly the risk becomes higher. And for an elective operation, we try to do everything again to minimize those risks and to keep you as safe as possible. So please, I know it's not an easy thing to do, but please try to stop at least a month prior to. And certainly I always tell my patients, if you can stop a month prior to surgery, then there's no need to go back to it. Okay, so that's the smoking thing. Now, in terms of the night before surgery, pretty simple. Eat your dinner around 7, 8 o'clock at night. And after that, please nothing to eat or drink. And I mean nothing to eat or drink. No juices, no water, no chewing gum, nothing to eat or drink. You can brush your teeth in the morning. You can take your medicine that you need to take with a little sip of water, but that's it on the day of your surgery. Please come to your surgery wearing comfortable things that are easy to take on and off. Bring socks with you because it gets quite cold in the operating room. This way your feet stay warm. And make sure that there's somebody there to pick you up from the surgical center and stay with you for at least 24 to 48 hours. You cannot be by yourself after surgery. For those of you who are going to be traveling out of state, my preference that you stay next to me, near me, at least for 5 days after surgery. I know it doesn't always happen, but the safest thing to do is for you to certainly hang out for 5 to 7 days after surgery. So if God forbid something happens, I'm here nearby to take care of it. Remember that you're going to have 2 drains, one on each side of your incision. Those drains will stay in for approximately 10 days. Sometimes I can remove them a little bit sooner. Sometimes they have to stay in a little bit longer. You will get my cell phone number, my private cell phone number, which will allow you to stay in touch with me 24/7. And on day 10, I ask that you send me a text message with the 24-hour output from your right and your left drain. And based on that, I will let you know if it's okay to get it removed or if we need to keep it in a little bit longer. Remember, you're going to be taking antibiotics for as long as the drains are in place. Once the drains come out, you'll be able to start your antibiotics. Do not let anyone take out your drains unless you have the permission from me or my nurse, Amanda, whom you'll meet on the day of your surgery. Okay, now binders, the story with the compression garments. I'm sure you've heard me talk about this before. I don't make a big deal out of compression garments because I truly believe that any compression garment is there only to give you support. It doesn't do anything for results. So you can think of it as a rubber band effect, because of course I hear quite a bit patients telling me, well, I've heard that you have to wear a binder or a faja for 6 months because it's gonna waist strain and it's gonna make the figure or it's gonna make the results. It's not true. It's not correct. Think about a rubber band on your wrist. If you put a rubber band on the wrist, it's gonna leave a mark and it's gonna compress the skin and create this sort of indentation, which is what a faja would do if you're wearing something super tight around your waist. But once you remove the rubber band, 15, 20, 30 minutes later, the mark is gone. It's exactly the same concept. Fajas don't give you results. Surgery gives you results. Healthy diet gives you results. Exercise gives you results. Fajas help to give you support, and for a period of time they're necessary. But remember, whatever you put on has to be comfortable. It should not be something that's painful or creating indentations in the skin, because then it's causing more harm than good. The garment is there only to give you support, and you could keep it on as long as you like. I typically give my patients a guideline where you can do about 1 to 2 weeks full time, so day and night. Of course, you take it off to take a shower. And then another 1 to 2 weeks part time where you keep it on during the day and then you take it off at night, or vice versa. Again, whatever gives you more comfort is what you need to do. After surgery, I'm going to ask that you don't do any major heavy lifting for a few weeks, 4 to 6 to 8 weeks, depending on how much heavy lifting. And the only thing I ask that you don't do after surgery is no running, and of course no heavy lifting, especially in the beginning, because the muscle repair has to heal, and we don't want you to strain your abdomen to potentially pop a stitch and lose the tightness in the abdomen. So just be very careful. Use your judgment. If you're doing something and doesn't feel good, you shouldn't be doing it. If you're doing something and it feels comfortable, then there's absolutely no problem. Now, in terms of being hunched over or straightening up, remember, there are multiple layers of sutures. You do not need to stay bent over. It's not going to help. You're going to have pain in the front, and then your back is going to go into spasm, and that's going to hurt too. So little by little, straighten yourself out. You don't need to stay hunched over for 2 weeks because it doesn't do anything. You don't have to worry about sutures popping. They will not. Just try to get yourself upright slowly but surely, and make sure that your back doesn't go into spasm. Now, pain control. I will give you a prescription for Percocet, which is a very strong pain medication. It's a narcotic pain medication. Fortunately or unfortunately, in Florida, the laws for narcotics are extremely strict. We're only allowed to give our patients 30 tablets, and we cannot refill prescriptions for narcotic pain medication. I do allow my patients to take Advil in conjunction with Percocet after surgery. Even though it's an NSAID, it's perfectly fine. You can take 4 tablets of Advil, which is the same as 800 milligrams of ibuprofen, and you can alternate Advil and Percocet. Remember, you cannot take Percocet and Tylenol because there's Tylenol inside the Percocet. A lot of times patients will come in on the day of surgery and say, oh, I bought Tylenol. And I always tell them, Tylenol cannot be taken in conjunction with Percocet. So just remember, make sure you prepare for yourself. Advil and Percocet prescription will be given to you. You'll get antibiotics, as I said before, which you will start the day after surgery, because you'll get IV antibiotics the day of your surgery. You'll also have a prescription for nausea medication. It's called Zofran, or ondansetron is the generic name, which is most likely what you get at the pharmacy. The nausea medicine is there only if you need it. If you don't get nauseous, you don't need to take it. I give it to you just to be on standby. I also ask that you prepare in advance and actually start taking in advance stool softeners like Colace. You can get Metamucil capsules, which are wonderful because you don't have to drink that yucky powder, but it helps quite a bit. Vitamin C, folic acid are excellent for healing. And after surgery, you can also consider doing protein shakes like Ensure, but please make sure that there's low sugar and low fat in those protein shakes. They also help with protein repletion and help with healing. So remember, Colace and Metamucil for constipation. Prune juice also helps after surgery. And then folic acid, vitamin C, and protein shakes low in fat and sugar after surgery will also help with healing. Now, in terms of follow-up care after your surgery, typically I ask that patients send me pictures 24 hours after. They also come into the clinic so that I or my nurse Amanda or the nurse practitioner from the clinic will see you for your 24-hour follow-up care. And then if you live out of state, we can continue doing follow-up care virtually with FaceTime videos, pictures, and text messaging. If God forbid there's any concern, any issue, then of course you just have to text me on my private cell, which you'll get on the day of surgery, and I will get back to you as soon as possible to devise a plan and figure out what we need to do. So that's the follow-up care. Now, remember, the day after surgery, very important, get out of bed, move around. I do not want my patients staying still. You have to make sure you move your feet if you are in bed, and you have to make sure that you take slow, deep breath in and out 10 times, kind of like this, while you're hanging out in bed the day of your surgery. No matter what, it is crucial that you make your way out of bed that day, and even making circles around the bed is better than not moving at all. Now, risks and complications. This is very important. It's not meant to scare anyone away, but I do want my patients to be well educated about the potential risks and complications. This is real surgery. It's not a manicure. It means that there's always a potential for infection, bleeding, potential for poor scarring, asymmetry, need for revision surgery, umbilical necrosis or death of the belly button skin, potential for flap necrosis or death of part of the skin that gets pulled downward, potential need for wound care. These are all things that are possible. They're luckily very rare, but after doing this for almost 15 years, I can assure you I've seen it all, and this is the reason why I always give my patients my cell phone number. So if God forbid there is a problem, you have a way of getting in touch with me so that we can take care of a problem sooner rather than later and not have it become a major issue. So I always ask my patients, be vigilant, make sure that if something doesn't seem right, you send me a text message right away, you send me a picture. Either I or my nurse Amanda will always check it, and we'll get back to you very quickly as we can. Okay, I think I covered pretty much everything pertaining to a tummy tuck. I hope that this gave you a lot of good answers. I hope that this helps to take away some of the anxiety prior to your surgery. And I look forward to seeing you or meeting you and doing your surgery. Thank you so much for watching. Bye-bye.